watching the medical segment of the Jennylyn Show, and I'm Jennylyn Gleave, your host. On this segment of my show, various physicians will be debunking myths associated with their specialties and sharing what is new and cutting edge in their fields of medicine. Today, Dr. Ernest Thomas, a family physician, is debunking myths associated with geriatric medicine. Again, here is another field of medicine with lots of common myths. Dr. Thomas debunks them for us, and hopefully knowing the facts will make a positive difference in your life or the life of someone you know. Stay tuned. Listen to what Dr. Thomas has to say. Here is Dr. Thomas.
The myth is when I become old, I will become senile. Not necessarily so. Senility is viewed by so many people in so many different ways that we don't really give it full credence for what it's all about. Senility is one thing. Senility is loss of memory and actually becoming decrepit and having difficulty with most functions. But getting old is not necessarily senility. I have patients who lived as long as 107 years old and were still functioning adequately. Currently I have 4 patients who are over 100, and they are still functioning reasonably well. Certainly as we age, we can become senile, but we can stay bright and active as ever. Choose our parents, okay? That's a done deal. But we can ignore our prior history, our birth history, and say to ourselves, we will not allow family history to interfere with our becoming older and creating a problem for ourselves. If you become active early on and stay active, engaged in physical activity and exercise, both mental as well as physical exercise, you don't have to follow the senility of your parents. It's interesting. That is an interesting question. I take care of a lot of patients in a care home, and I have some little ladies in their late 70s who have remained sexually active, and gentlemen who are about their age also remaining sexually active, not as frequently as some of them would like, but you can remain sexually active. There are medications that help. There's now a big push to giving testosterone to men, and there's a big push to using vaginal creams to help females have more comfortable sex. But it doesn't have to stop simply because you reached 80 years old. One big problem is we have a lot of ladies who are aging and their husbands are dying. And so a lot of ladies are single, and it is then more difficult for them. But physiologically, it is still very possible. Brain power doesn't necessarily decline with age. If we remain active, if we read, if we do crossword puzzles, if we engage in mental gymnastics, we do crossword puzzles, read magazine articles, not just sit there and watch TV and get little snippets of news, but actually read the newspaper, go online, read a blog, and participate in blogs. All of those things will keep your mind alert and active. Stay involved in current affairs. Listen to what's going on in politics right now. No matter what your beliefs are, you can be an active participant up until the day you die. There's no known cause for you to not remain intelligent and active mentally. I've heard that throughout my life because I'm bald, okay? My father was bald. My mother's father was not bald. My father's father was not bald. So the bald may have come from someplace else in my family tree. And I don't know exactly where it came from. I inherited those recessive genes that said, I'm going to be bald. But men, because they have testosterone, we know that the gala maybe gets a little bit tighter, reduces blood flow to your hair follicles, and it can cause you to lose your hair. That's being treated now with various and sundry lotions and shampoos. So it can reverse itself. In Sweden, they were actually doing incisions in the scalp to allow more blood flow to grow more hair. But it's a brutal procedure, but it works. It works. Okay. I think that low-intensity exercise would be beneficial for those people who have joint pain or some other disability. But low-intensity exercise, I just have a problem with that. That does not help you gain stamina. I don't think you need to go out and join a gym and do the 4-minute mile, but I think vigorous exercise is what keeps us vigorous. I think that is not a myth. I think you inherit a lot of things, and the way you age certainly can be inherited. The wrinkles in your face are generally inherited. Okay, the pattern of wrinkles is an inherited gene. So possibly the way you age can be genetic. I think that's an individual thing. That is a set of circumstances, not just aging. I can't see that just getting older would cause you to be more depressed than other people. I know some very happy people who are over the age of 80, okay? And it has nothing to do with their age. It has to do with their personalities and who they are, where they are, what they're involved in. The myth is that older people cannot perform their jobs as well as they could at an earlier age. Not necessarily so. Witness the airline pilots who right now are forced to retire at age 60. They're probably at their peak of performance at age 60. With the experience they have, with the skills that they have, this is a loss to us. These gentlemen should be, and ladies, should be allowed to continue flying because their skills are at the pinnacle at 60. Aged people who are doing mechanical things can continue doing mechanical things as long as they're able to move. Okay, so that is truly a myth. That, not necessarily so. Some of the longest living people live in central Russia, where the temperature is a little bit lower, the amount of nutrition is less, and they tend to live into the hundreds. That's really a myth. The sunscreen not being necessary in the winter is beyond a myth. In fact, it's dangerous because the glare of ultraviolet in the winter sky can bronze your skin just the way bright sunlight does. So if it's a bright day, even a cloud-covered day where the light is bright, you're exposed to ultraviolet light, and you should be protected. Okay. It's hard on your eyes. It can cause problems with increased glaucoma, cataracts, and can burn your skin. I like to use diet supplements because I think it keeps patients busy, but I don't think that diet supplements slow aging. There's been no scientific proof, there's been no double-blind studies that show that supplements actually slow the process of aging. Losing weight as harder as you age is also likely a myth. Weight loss has to do with the amount of calories you take in versus your activity. So it's calories in, calories out, no matter what your age is. Now, the only reason why that might seem to hold water is older people probably are not as physically active, don't burn as many calories, don't need as many calories to function. So they may have to look at eating less in order to lose weight. But if the activity increases, they don't necessarily have to eat anymore. Okay. The myth is since we lose millions of neurons daily, we become dumber as we age. That too is a myth. A common cold can cause you to lose millions of neurons. Losing neurons, we always thought central nervous system cells were not replaced. But I think the latest scientific information says that we do regenerate some neurons. and thought processes are stored in your neurons. And again, if you remain mentally active, if you read a lot, participate in puzzles and crosswords, and read exciting material, read new things, and engage yourself in new things, your mental sharpness can stay. The myth, lifestyle changes won't help me when I get old. Well, let me tell you, if your lifestyle says that we're going to play tennis every Thursday, and you continue to play tennis every Thursday, your activity will stay with you much, much longer. Okay? Much, much longer. The more physically active you are, the more likely it is you will remain physically active throughout your lifespan. Destiny is out of your control. Is that a myth? I don't know. I will state this, that if you plan your life, if you plan to do things, if you plan to travel, as you get older, if you plan to experience new things and make sure that you do, and travel is one of the big things, since your responsibilities probably will be less, you have more time to travel. Travel is a great educator. It's, I think, life prolonging, unless you go into one of the troubled areas of the world. And I think that can be uplifting to you. The inevitability of frailty with age is not necessarily so. If you are active, if you participate in activity that allow you to stress your bones, do resistance training, walking, resistance, just doing simple push-ups can make you less frail. Older people don't necessarily break their bones any sooner than anybody else will, unless they genetically have osteoporosis and engage in stressful activity. You might then have more of a difficulty. But if you remain active, your bones will stay stronger, and you don't necessarily become frail. Okay. Nutrition and activity really help you to stay healthy. Happiness will decline when you get older. I disagree with that, okay, totally. Some of the most joyful times in my life have happened after 50. It's a matter of what you expect out of life, what you take a chance on, the things that you engage in, all can make you happier. Aging alone should not be a reason to be depressed or unhappy. That is truly a myth, okay, truly. I have a lot of elderly people who have chronic illnesses like osteoporosis and hypertension. But you know, if you take care of yourself, if you follow the rules of preventative medicine, if you follow the rules of good nutrition and activity, you don't have to be sick, okay, simply because you're older. If you have bad habits and you don't try to break them, just like any other habit, an addiction, if you don't decide to stop smoking, if you do smoke, then yes, you'll continue to have a problem. But anything you want to overcome, you have to first address it and then take whatever measures you can to overcome it. Okay. And that's possible, no matter the age. You know, I've lost a couple of inches already in height, but learning, no, I'm learning something every day. If you are a loner, and you tend to enjoy being alone, you will be a loner. That can happen at any time in your life, even in high school. Young, healthy teenagers who decide to become loners, if they don't change, will remain loners. Just when you become older doesn't necessarily make you a loner. An outgoing person will remain outgoing. You'll have fewer friends, not because he doesn't make new friends, but we lose our friends through death and other causes. But that alone does not make you a loner. Aging doesn't make you necessarily adjust to sleep changes. Travel still affects us all. You take a trip to Europe, you'll need to get some sleep on the plane, and you might have a little bit of jet lag. But if you drink adequate amount of water and prepare yourself ahead of time, by drinking more fluid in your system, avoiding excesses of salt, you can travel reasonably well and not have such sleep habits when you get to your destination. Sleep habits where you are unless there's some activity going on that will interfere with it. If we avoid taking excess sleeping pills, avoid using alcohol to go to sleep, then our sleep habits don't necessarily change very much. There's an old myth about the older you are, the more sleep you need. But in some instances, the myth is as you get older, you don't need as much sleep. That too is an error. We need about 6 to 8 hours of sleep every night, no matter your age. Snoring may increase with age simply because the upper airway may become more relaxed and tends to drop down more easily when we lie on our backs. So snoring may be more prevalent as we age. That certainly can happen. I've been forgetting things for all my life. I've misplaced things all my life. Yet I've done very well mentally. And as you age, you don't necessarily forget everything. Certainly with dementia, yes, if someone has atherosclerotic changes in the brain, you certainly can have some short-term memory loss. But it's interesting that long-term memory stays much, much longer. We don't learn new things, so short-term memory kind of goes by the wayside as we age. But again, if you practice, if you participate, if you read, if you do the mental gymnastics, that helps to maintain your memory. So even though you age, you can still combat memory loss. Every day I meet people who wonder about grandma, my mom, she's getting worse, she can't remember anything. The memory problem is the big issue for most people. I'm worried about mom wandering off, she forgets where she lives. These are all dangerous things, and they certainly do happen with dementia. The fact that one should not be as physically active as they get older, we tend to tell our relatives, slow down, don't drive, don't do this, don't do that. And what we're doing is we're limiting their ability to continue functioning. Now, one shows that they cannot handle an automobile. They show that they're running into things that they should stop. Their license should be taken away. Okay. But if they remain active and participate in the rest of the world, they can stay active much, much, much longer. Okay. Right now I have one patient who unfortunately passed away not too very long ago. She was 107 years old.